Dignity Health was actually established in 1986 by the Sisters of Mercy, which is a Catholic women's order. Chandler Regional Medical Center joined Catholic Healthcare West in 1999, along with our partner hospital, St. Joseph's Hospital Medical Center. Then in 2006, Mercy Gilbert Medical Center opened, which is actually one of the first hospitals in Gilbert. In 2012, Catholic Healthcare West changed the name of the organization to Dignity Health to better represent who we are as an organization. Fast forward to 2019, we, along with Catholic Health Initiatives, we joined our ministries together in order to form Common Spirit Health. And Common Spirit Health now is one of the largest nonprofit organizations in our nation. And that's pretty significant because it really gives us leverage to be able to better have the resources, the talent for caring for our patients in the doors of the hospital as well as in the community and advancing the mission of the organization as well. Our values are compassion first and foremost for every person that we care for. Collaboration. An example of collaboration is I collaborate with the community a lot, develop partnerships to improve access to care. Integrity, inclusiveness, and of course excellence is very important. So the oral health program, for example, it starts with making sure you have the right people on your team who have not only skills for the job, but compassion for the people that they care for. And that's quite evident with our dental team, whether it be in the dental clinic or our First Things First program that's at community settings throughout our service area, or in the ICU, right? It's all important that they have that. So it's this great opportunity to really provide outstanding care to the community.
In 2009, Dignity Health established their First Teeth First program from funding by First Things First that comes through from state tobacco tax funding. The target population that we serve in that program is expectant mothers and children up to age 6.
This is a program that provides oral screenings, fluoride varnish treatments, education, and we also do navigation and referral. We also do care coordination for our patients. We're gonna brush when the sun comes up and before we go to bed at night, and we're gonna brush 2 times a day, okay? I think what makes us really unique is that we look at the entire family unit. I will ask the mom or the dad or the grandma, tell us about the oral health of your family. Are any of you suffering from pain or any problems in your mouth? And are there any resources we can help your family with?
We don't realize how a toothache can really affect their overall wellness. If we're able to get them taken care of, it just changes their whole overall wellness. They feel better, you know, they're eating better, they're not missing as much school, and then they're also able to learn those behaviors that's gonna change for their future generations.
We know that more than 32% of children from low-income households have untreated dental decay, and 22% have never seen a dentist. By addressing oral care needs early in life, dental disease, pain and suffering, and higher healthcare costs can be prevented. The program goes to pediatric medical offices, OBGYN offices, women, infant, children centers, also to daycares, and to a few different community health centers also. Although largely preventable, dental caries or cavities is the most common chronic disease among children and young adults. Additionally, we know that low-income and minority children have greater dental treatment needs than most children. The Dignity Health Children's Dental Clinic was developed to address the social determinants of health and remove barriers that our community faces accessing traditional dental practices.
When a child comes to our clinic, first of all, we are able to help identify any dental needs that they have. We establish a relationship with them. We provide them with preventative education, preventative care, whether it's with fluoride varnish, oral hygiene instructions. And the most unique thing about that in our relationship with our families is that they don't have to worry about the financial barriers. They don't have to put off care. They can come to us and we can help them.
Our services are provided at no cost to our families, and our clinics are 100% grant and foundation funded by generous donations. There are several things that make our model unique that we're excited about. The first is affiliated practice dental hygiene model that allows direct access to preventive dental services. The second is that we utilize a promotora. A promotora is one of our team members that's from the community and is bilingual and really makes a strong connection with the families. The promotora helps the families set dental goals on oral health care at home and also works with them for their care coordination. We are proud of the children's dental clinics because we have demonstrated successful outcomes in reducing dental decay, improving oral hygiene, improving oral health behaviors at home, and completing appointments for restorative care. The Intensive Care Unit Integrated Program began in 2018 from a grant from Dental Trade Alliance that we were awarded in order to do a research study on outcomes of integrating dental hygienists within the intensive care unit at Chandler Regional Medical Center. The critical care dental hygienists provide services in the intensive care unit alongside other medical providers, and the services that they provide as part of this integrated team is bedside oral exam, and also they offer a oral care protocol at the bedside, which includes debriding the oral cavity, cleaning the oral cavity, and moisturizing. Some of the goals of the intensive care unit integrated program is to reduce ventilator-associated pneumonia, also to reduce the length of stay for the patient in the hospital, and to improve their chances of recovery and reduce loss of life. A secondary goal for our intensive care unit program is to train the next generation of oral care providers. So in order to accomplish this goal, we work with local dental hygiene programs to have dental hygiene students come and rotate through, and they get a clinical experience integrated right here on the floor of the intensive care unit. I'm glad to be here to be able to provide these services in a dignified way, in a compassionate way, and it's very meaningful, not just for them to get dental care, but also we're building relationships and we're this kind of safe haven for folks in the community.